Assalamu alaikum and welcome to this first lecture on patient safety. This is part of your Bridging Course 1. Altogether, I will give two lectures, or actually three lectures on patient safety in this Bridging Course 1. And I will really want you to have a look at these because these are very important. This is a very important concept in medicine so that you can be an effective and safe doctor in the future. During this lecture, we want to understand the concept of patient safety. What does it mean, patient safety? It's a big word. We want to break it down. We want to look at reasons for adverse events in emergency care, but also in care as in general. Discuss ways of reducing such events, and we will focus on medical systems, human factors, learning from error, and teamwork in the course of this lecture. Just as a background, the WHO found surgical site infections in developed countries to be between 19 and 31%. They found that 25% of all drugs are counterfeit. In 7 studies, adverse events occur in up to 16% of hospital admissions. And in Australia, 18,000 deaths occurred as a result of adverse events. In the USA, there were 50,000 each year, roughly. So in Palestine, actually, we also have a number. A study done in 2013 by Al-Najjar, which used a global trigger tool to assess the adverse events that happened in Palestinian hospitals. This was done in the West Bank, and it showed that 1 in 7 patients admitted to hospital actually came to harm during their hospital admission, and almost 60% of these events were avoidable, had been avoidable, so should not have happened. Okay, and we look at what are the ways we can actually avoid such events. So most adverse events do not lead to patient harm. And in many countries' healthcare systems, these events and errors are ignored because no harm occurred. It is felt, never mind, we'll leave it at that. However, only by recognizing those events that do not lead to patient harm, we can learn and prevent such events from happening that in the end will lead to patient harm. So what I mean is it's only a matter of time. If events happen that do not lead to patient harm, it's only a matter of time when one happens that actually leads to patient harm. Therefore, it is very important to recognize all potentially harmful events and look at them to avoid future harmful events. Most common adverse events are due to management, diagnosis, or medication. And I will give you one case now, which I want you to just have a quick think about. And we will come back to that later on as well during our lecture. So patient A comes to the emergency department with neck stiffness and a high fever. A diagnosis is made of bacterial meningitis. He is allergic to penicillin, but nonetheless he is prescribed and given penicillin in the emergency department. So I want to ask to you, who is responsible for this mistake? The doctor who prescribed it, the nurse who gave it, or the pharmacist who dispensed it? And I want you to just take a few minutes to think about this question. So what I hope you might have come up with is that all of them or none of them were responsible for this event. Responsible was the system. There are many ways that can be embedded in the system that will kind of prevent such a penicillin dose being given to a patient who's allergic. And we will later on come to such. We will in a bit come to that as well. So what were the possible factors that leading to this event, leading to the fact that the patient who's allergic to penicillin was given a dose of penicillin? Which factors can you think of? Just take a minute to think about these factors. They can be patient-related factors, they can be provider-relating factors, they can be task-relating factors, technology or tool-related factors, team factors, environmental factors, or organizational factors. And just to illustrate this, I want you to have a look at this Swiss cheese model of accident causation. Okay, so this was kind of illustrated by Reason a long time ago, actually, maybe 1999, around this time. And it shows that in order to actually one event to happen and come to harm, it has to actually go through a lot of holes in this Swiss cheese model. So in our case of this patient who received penicillin, although he was allergic to penicillin, you could have had the doctor who could have checked the notes, the notes he came in with, to check if there were any allergies recorded on the notes, so to prescribe something else. You could have had the nurse who could have asked the patient, are you allergic to anything? And that would have kind of also prevented the penicillin to have been given. You could have had the pharmacist actually checking the notes and looking at the drug cardex to see if it was any allergies were recorded on the drug cardex before actually dispensing the penicillin. At all of these times, the accident could have been prevented. So in fact, there's other ways as well that you can prevent such accidents. And one very important one is that every patient who's known to have an allergy gets a wristband, a red wristband, written where the allergy is documented on as soon as they get into the hospital. And in that way, the nurse would have seen this before actually administering the drug and seen, there's an allergy, and would have checked with the patient. You should also have documentation of allergy on the drug chart, and in that way the pharmacist would have been easily alerted to it. You can involve the patient in the healthcare team and ask him, do you have any allergies? Or the patient could have been involving themselves and say, I just so you know, I'm allergic to penicillin. And then before administering the penicillin, the nurse could have kind of stopped herself or himself. Double checking of medication is also very important. Okay, so if there's a standard routine of double checking medication before it is given, a second nurse or a second doctor could have seen, have you checked for allergies here? And you can have communication between the healthcare team. If one has some idea and knows something, they should communicate it to the others. And these are what Reason called the defenses for the patient. So in this illustration, you see the potential adverse events on the left side, and for them to reach the patient on the right side, it has to be going through these the holes of these different defenses. One defense is policy writing and training, so that you keep to one policy, such as, for example, double checking drugs, always putting wristbands on, always asking the patient. This is something you always do, and this is a good defense of potential harm. Also, standardization and simplifying is a good defense, because that makes the work easier and makes adverse events less likely to happen. Automation is important, and such automation could be, for example, in electronic notes, where all allergies should be recorded in the notes, and automatically, if you want to prescribe penicillin, you are being warned this patient has an penicillin allergy. So this is also a good defense. And finally, you also have improvement to devices and the architecture, making the because sometimes it is actually the workplace that makes that promotes harm to the patient, when it is a very busy place, when the people are kind of distracted all the time. Just imagine the doctor making the prescription, and at the same time a relative of another patient wants to talk to him and ask him some questions. Then it's easy to kind of make mistakes in this job. So this is also a very important part of ensuring patient safety within hospital care. So what are the most common factors leading to adverse events? What do you think are the most common factors? Have a quick think about it. One is delay. Okay, so that patients get delayed because different factors delay can happen due to many factors, but this can cause problems for patients. Overcrowding of the unit is one, and this also causes delay, but it also causes distractions and difficulty to actually do a job and continue with it in a safe way. Poor staffing levels are one. Unavailable specialist staff and medication error is actually a very common cause for adverse events. So we're going to look at the human factor within these accident causation, or within the causation of adverse events now. What is meant when we talk about human factors? What are human factors? Human factor definition is that these are all factors that make it easier to do the work in the right way. It is the relationship between humans and the factors with which they interact, and it aims to improve efficiency, productivity, creativity, and job satisfaction. It applies wherever humans work, and sometimes it's also called ergonomics. So human factors can also be called ergonomics. So, for example, in this, the importance of human factors has first been recognized in the aviation industry and the nuclear power industry. And you can see here, an airline pilot who sits in front of his dashboard, and you can see that it's easy to make mistakes here unless there's a way of display that makes it easier for the pilot to navigate through this array of buttons and screws and dials. So what importance do they have in healthcare? You can see here is a picture from an intensive care unit, and there's a similar array of machines and pumps and screens that also have to be navigated by the staff. And so they also have to have a way of dealing with this complicated array of machinery. However, it has only been recently acknowledged that it also is an essential part of patient safety. So to provide workplaces which are easy to navigate, equipment which is easy to use, is an essential part of keeping patients safe. It is a major contributor to adverse events in healthcare, and all healthcare workers need to have a basic understanding of human factor principles. So here's one example I wanted to illustrate to you. This is a defibrillator. And on the left side here, you see the old style defibrillator, which we used to use when I started in healthcare and in my career and as a doctor. And you have these two paddles, which before you can use them, you have to load them to the correct joule size, and then you have to put them on the patient and unload them, then you have to reload them. And so you can see there's a lot of dials, a lot of buttons to press, and a lot of processes within the same within one doing a defibrillation. And defibrillation is done in an emergency situation. So in emergency situation, people are always slightly rushed and stressed, and so it is a potential for problems. On the right side, you see the new automatic defibrillator, which actually can be used by lay people and is available everywhere in swimming pools, schools, universities, and so on, to be used by lay people. And you can see that it has only 1, 2, 3 steps to use. It has 2 pedals as well. Sorry. It has 2 pedals as well, with a picture to show where to put them on the patient. Then they stick on. Then you put it on at 1. Then the defibrillator assesses the rhythm for the patient. That takes maybe a minute or so for the defibrillator to assess the rhythm. And then it gives you instructions and say defibrillate, in which case you press number 3, or it tells you this is a non-shockable rhythm, and in that case you cannot defibrillate the patient. Okay, so all these steps follow one another and are kind of automated, whereas in the first example, the machine on the left side, these were decisions the doctor had to do within the emergency situation when they are stressed anyway, so leaving the door open for many mistakes, which on the right side, the example is much easier to follow. And here you can see again 2 more pictures, one from an anesthetic machine in the operating department, and the second is also a picture from a intensive care unit where people make an X-ray, and you can see that the people here, there's a lot of people working together, a lot of machines also working in this picture, and you can see that healthcare is a complicated system, a complex system. It's not a simple system just involving a patient and a doctor. No, it involves teams, equipment, machines, and so on, and which complicates the system. So here again, this is a picture that illustrates to you how human factors are involved in machine design. You can see that the doctor on one side has got psychomotor skills, which involves the hands and pushes the input buttons, and also the machine puts out the display that has to be read, and also puts out some sounds and alarms which the doctor has to hear. And this interface between human beings, so doctors, nurses, healthcare professionals, and machines, is important to make it as easy as possible. And we had this example of the defibrillator kind of showing how it can be made more easier to use for people. So human factors acknowledge that the universal nature of humans is that of fallibility. So we are all prone to make errors. We can all make errors at any time. And it also acknowledges that errors in medicine are inevitable. So human factors assumes that errors will occur. So it uses design and design of equipment, design of machines to minimize this likelihood of error, and also to minimize the consequences of error that might occur. So here's another picture for you to really look at. You can see 2 eye drops in identical packages, but with different kind of medicines inside. So it's easy to make a mistake here, that you grab the wrong one. So you grab one when you meant to grab the other one to kind of give to a patient, or even the patient can make the mistake themselves. And actually, in my time when I was a medical student, I remember I did the internship. And I remember that there was a case in Germany, not where I worked, it was kind of another place in Germany, where we used to have the potassium chloride and the sodium chloride in similar, identical little vials, plastic vials, even with the same writing, the same color on it. And it had happened, as it had to happen at some stage. Somebody wanted to flush a Venflon with normal saline, but they took the potassium chloride and flushed the Venflon with potassium chloride, and of course killed the patient in the process. So this was a tragic mistake, and there will have been many factors that led to this mistake. But one factor was that these 2 vials were actually indistinguishable. After that, the many things changed with regards to potassium chloride. The main thing was that each vial was different and kind of distinguishable just by looking at it. And the second is that potassium chloride was now not added on the ward to the infusion bags, but it was added in pharmacy. So when it was ordered, had already been added to the kind of infusion solution. So reducing the potential for risk on a busy ward in a busy situation. And here's an example of different infusion pumps, and you can see that they all they all have similarities, but they all also work differently. So in every workplace where you come to, you have to familiarize yourself firstly again with the infusion pumps that are used, or with the equipment in general which is used, because it can be different from place to place and hospital to hospital. And in every place you have to first make sure that you understand all the equipment and can use it safely before using it on your own. So it is good that the human copes quite well with complexity. Okay, so healthcare workers are good at compensating for some of the complex and unclear design of the workplace. This is true for equipment as well as for physical layouts. Because the human brain is powerful and flexible, it finds shortcuts fast, and it can filter information. And it is good at making sense of things. But sometimes we should not always rely on our brain. And I show you, here's a small example that I want you just to try out now, so you know how your brain can maybe trick you sometimes. In this example, I want you to to look at the chart and to say the color of the word and not the word itself. So you take time now, you do this exercise, you say the color of the word and not the word yourself. And you tell me, or you take note of at what word you make this first mistake in this. So situations are associated with increased error. Some situations are associated with increased error. What are such situations that have an increased risk of error? And what are individual factors that contribute to error? Take a minute to take a notepad, a pen, and take a minute to write down answers to such questions. Situations which are associated with an increased risk of error are such situations when you are unfamiliar with the task to do, when there's inexperience or lack of supervision, where there's a shortage of time. So time pressure is a very common factor to lead to problems and adverse events. Inadequate checking, when there are poor procedures, and when there's poor human and equipment interface, and we have already looked at that. So individual factors that predispose to error include our limited memory capacity, and which this can be further reduced by fatigue, by stress, by hunger or illness, by language or cultural factors, and by hazardous attitudes. So by attitudes which do not take care of risks that are associated with certain procedures or things that we do in healthcare. So let us have a look at how can we identify such problems, and what can we do about them. One way of identifying problem hotspots is incident monitoring. What is incident monitoring, and what does this involve? Incident monitoring involves the collection and analysis of information about any events that could have harmed or in fact did harm anyone in the organization. Okay? It is a fundamental component of an organization's ability to learn from error. So, an incident monitoring system in a hospital allows every healthcare worker and also cleaners, actually, because cleaners also are faced with problems. Sometimes they find sharps sharps, and they get injured by sharps in the rubbish and so on. So anybody who works in the organization can actually report an incident and should report an incident. An incident which had the potential to harm someone or did in fact harm someone. By collecting such information on incidents, then you can identify certain error traps within the organization. So you can identify maybe times, maybe shifts, maybe tasks or procedures that are especially prone to kind of have errors happening, or where incidents happen. Okay, so an incident reporting system has the function of identifying recurring problems known as error traps. Okay, by identifying such recurring problems, they can be removed. It can be such error traps can be removed, and this is one of the main functions of error management. So this is just making an illustration. Before the incident, you have a lot of, you can see in this illustration, you have a lot of possible potential error traps within the work processes. After the incident, it is much more straightforward. They have simplified some of the work procedures and only one error trap remains. The idea that you have to understand with this with such an idea, what needs to be understood is that error traps cannot usually be avoided. Okay, as I said, errors are kind of part of human nature, and we are doing errors, but it has to be managed so that they are less likely to happen, and that also we are more likely to reduce the impact and the harm that can occur to the patient with any error. Okay, we come now to the next big influencer of patient safety, which is culture. Okay, this influences the way of dealing with errors. It also influences the way that an organization learns from error and can actually adjust their procedures, policies, and behavior in order to reduce error and enhance patient safety. But what is culture? Culture is a set of shared values, so what people think is important, and beliefs, how things work, that interact with an organization structure and control system to produce behavioral norms. Okay, so this is usually, you can see a culture, a culture when you come to work in a new place, and somebody tells you this is the way we do things around here, then you can see, aha, this is their culture. Okay, this kind of is a way of kind of introducing you to their culture. Incident reporting and monitoring strategies should be part of an organization's culture, and they should include anonymous reporting. They should include feedback given to the staff, to the team that reported the incident. They should be an open acknowledgement of successes resulting from incident reporting, and they should also include reporting of near misses. A near miss is when something happens that could have led to a serious harm, but it didn't. So, for example, the nurse already wanted to give the penicillin to the patient, but in the last moment found out, the patient told her, I'm allergic to penicillin, and so she kind of went back and asked the doctor to prescribe a different medication. So this is something that is a near miss, and it is a free lesson that a free lesson for the organization that can be learned from. And system improvements can be instituted as a result of the investigation of reported incidents. But in near misses, you have no cost to a patient because no harm has yet occurred. And you can then prevent future harm. Okay, so let us now come and talk about team and teams and their importance in patient safety. What is a team? A team is a group of 2 or more individuals who interact dynamically, have a common goal or mission, have been assigned to a specific task, and possess usually specialized and often complementary skills. So they work together as a team, and each of them contributes a special skill to the team, and this is why they kind of are actually good and function well as a team. So Eduardo Salas has done a lot of work on teams and in healthcare, and he kind of put out the following kind of more formal kind of definition. As a team is a distinguishable set of 2 or more people who interact dynamically, interdependently, and adaptively towards a common and valued goal, objective, or mission, who have been each assigned specific roles or functions to perform, and who have a limited lifespan or membership. Okay, so you find teams with different lifespans. Okay, so you have, for example, a cardiac arrest team that might only meet once on one cardiac arrest for one time. Then you have teams that work like a shift together. So you have a team on the morning shift, on the night shift, you have a team, and you have teams that are more long term, such as the team that runs one unit in one hospital. And you might even have a team that is even longer term, which is the team of the whole unit in the hospital, not only the team on one ward, but the whole unit of the hospital. So you find all these different teams in the healthcare setting, and in the course of your career, you will be part of many different teams in this sense. But what we want to look at now is, how do teams improve patient care? Teams represent a pragmatic way to improve patient care. Teams can improve care at the level of the organization, the patient, so it can improve outcomes and patient safety. The team can be improved as a whole, and the individual team member can also improve patient care. So you have many ways on which teams actually improve patient care. And here, take a bit of time and look at this little cartoon that tells you the advantages of a team, where 3 people help each other to bridge, to kind of be carried across the gap that you can see on this in this structure. Okay, so every member in a team has times when they need support, and every member of a team has also times when they give support. And this is the important function of a team. Individual talents get magnified many times over through the collective lens of an effective team. Okay, because everybody brings something else they can contribute and actually achieve something really great when they work as a team. So what makes for a successful team? So a common purpose, so everybody wants to achieve the same thing. Measurable goals, so the team can kind of look at their work and say, we achieved this and this, but on this point we have to still work on, and that's one point we still have to really do a lot of effort in. Effective leadership is very important, and conflict resolution as well, because within a team you might have different opinions and different ways of looking at things, so this has to be resolved. Good communication is at the heart of every good functioning team, and as well as good cohesion and mutual respect, so that every team member gets respect for their role within the team. Situation monitoring is important. self-monitoring is important, and flexibility. So every team member has to have a kind of some flexibility on how they do the work and approach a problem. I want you to just have a look at this picture. It's from a children's book that I used to read to my children when they were small. It's called Swimmy. And Swimmy is here one of these little fishes. He belonged to a flock of fish, of these red fish. He's actually the eye within this these red fishes. And Swimmy lived with this flock of fishes in one kind of corner of the ocean, of the big ocean. And he lived in this corner of the ocean because there the tuna fish that you see on the right side here, the tuna fish could not get into this corner of the ocean. He was too big. But if Swimmy and his kind of friends from his the other red fish came out, they would have been eaten by the tuna fish. And therefore they stayed in their little corner of the ocean. But Swimmy wanted to see the world. He wanted to see the ocean and explore the ocean and not stay in his little corner because he was scared of the tuna fish. So he got together with his friends, and all of them wanted to explore the ocean and see the ocean. And all of them thought, what we do is we will get together in a formation of one big fish, and we'll make one big fish and explore the ocean like that. And as in every nice children's book, it has a good ending. This is what they did. They all made a big fish like this, and the tuna fish did not eat them because he thought they were one big fish. So the characteristic and what is important in our lecture from this little story is that you find the fish here in this big fish. Everybody works together. Everybody has their place within this big red fish, and everybody kind of has their important role within that. And only together they can actually achieve to actually see the ocean, because only together they can fool the tuna fish to make one big fish. And this is also a team in healthcare. In a team in healthcare, everybody has an important role. Everybody has to be respected for this role, and everybody relies on each other to kind of make the best within their role. So there's also leadership in every team, which is important. Like in Dabka dances, you have this leader with the kind of little kind of piece of cloth at the beginning of the line. In this story that I told you about Swimmy was the leader because he put everybody together to make such a fish. And also in healthcare teams, leadership is very important. And effective team leaders coordinate and facilitate teamwork. They delegate tasks or assignments, so they don't keep everything for themselves. No, they delegate a task and assignment. They conduct briefs and debriefs. They empower team members and speak freely and ask questions, so that every team member feels free to contribute to the team process. They organize improvement activities and training for the team, and they inspire followers. So that means they inspire their team members. They have a positive group culture and not a culture that puts people down so that they feel bad. No, they have a positive culture that respects team members and gives everybody a good that appreciates everybody's contribution. This is a very important part of a good leadership. Communication is another very important part of a well-functioning and efficient team. And I want you to ask you, why is this? Why is communication important? Of course, it is because you have to exchange communication information. You have to all sing from the same hymn sheet in order to sing well. You have to ensure that everybody knows and is aware of what the team wants to achieve, the aims of the team, and to ensure patient safety. Everybody should know what they have to do and when they should do it. However, the biggest single problem with communication is the illusion that it has taken place. So what did George Bernard Shaw mean when he said this quote, when he said this sentence? He means that you might say something to somebody and say, go and get the emergency trolley, or go and take these bloods to the laboratory, but the other person might not have heard you in the moment, in this situation. They might not have kind of taken on board what you have said, or even recognized what you have said in the situation. Okay, so this is something very important, and therefore effective communication has to be clearly formulated. So it has to give a clear message. It has to be addressed at specific individuals. So it's the best thing is to use names and make eye contact. So say, Mohammed, take these bloods and bring them to the lab now, for example. It has to be delivered clearly, concisely, and unemotional. So not in a huffy puffy way, but in a clear and unemotional, concise way. It has to be heard, so it has to be given at a good volume, and it has to be understood, acknowledged by the person who was in receipt of the communication. And for this, we often now refer to as closed loop communication. So that you say to somebody, give instructions to somebody, and in that moment of an emergency, for example, that person who received your communication refers back to you. So they say something like, you say to them, please take these bloods to the lab now, and you return back to them, or the person who kind of was addressed says, I will go and take these to the lab now. This is what is called closed loop communication, and it makes it makes communication effective. There has been a number of techniques developed to promote communication in healthcare, so to make it more efficient. This can be SBAR, call out, check back, handover, handoff. There's different ways of communicating, and it is good in one organization to follow one way. I worked in organizations that use SBAR. So SBAR is an abbreviation for situation, background, assessment, and recommendation. It wants to remind the person making a phone call, for example, that when they communicate to somebody on the other end of the phone, for example, you are on call at night, you have a patient you need advice from the consultant who's asleep in their bed at home, you ring them and you wake them up. In that situation, you have to give clear messages to that consultant so they can follow you and follow what you say. So you should start with the situation, give the background, an assessment, and recommendation so that they can get a good idea of what's going on. Other requirements for effective communication include that you should always introduce yourself to the team so that everybody knows what your name is and what your role is. Reading back, so closed loop communication, I have already talked about that. Stating the obvious in order to avoid assumptions is also important. So, for example, if a patient has collapsed, you say this patient collapsed on the ground so that they know. Or if you have already checked the patient, and say this patient has a cardiac arrest. Even though everybody should see this and be aware of this, it's always important to make that statement. Asking questions, checking and clarifying is important. Delegating tasks to people, so to specific people, not just saying, get an ECG, and nobody will go and get the ECG because nobody feels they should leave, for example. So you say to somebody specific, Amna, please go and get this the ECG machine so we can do an ECG. And she tells you, okay, I go and get the ECG machine, so that it is clear and that this will happen. You should clarify your role, and you should use objective and not subjective language. Requirements for effective teamwork also include that you should actually learn and use people's names. you have to be assertive when it is required. Okay. And if something doesn't make sense, finding out the other person's perspective is important within a team. So trying to understand others, because maybe it's just you who doesn't understand. Doing a team briefing before undertaking team activity is always good, and also debriefing afterwards. And when conflict occurs within a team, it is it is better to concentrate on what is right for the patient and not on who is right. So if there's a disagreement of what should be done for a patient, one should not say, who says what, but it's more important to concentrate on what is actually good for the patient in the end. The most efficient team, this is from a publication within the British Journal of Obstetrics and Gynecology from 2011. It is done by Sia Sakos, who has kind of developed a lot of the teamwork research and looking into research in emergency, in healthcare settings, actually. So what he says is, the most efficient teams stated the problem and declared the emergency earlier. Okay, so the earlier you state the emergency, the more the better you will be, the better will be the outcome. The most efficient team manage the task using closed loop communication. They administer treatment more quickly. They have fewer exits of the team from the room, and they have structured communication, such as S-bar style. And these are all factors that make a team more efficient. Okay, so to summarize now, complexity of healthcare and human factors make errors inevitable. Patient safety can be ensured by systems approach, which reduces the risk of human factors causing an adverse event. Other important factors to ensure patient safety are teamwork and effective communication. And all of these factors can be learned and they can be trained by teams. This is why simulation training of dealing with emergencies is actually quite effective in improving outcomes from emergencies, reducing morbidity and mortality in patients. Okay, I hope that thank you very much for listening to this lecture. And if you have any questions, do not hesitate to contact me by email or when we see each other in the college. Okay, thank you very much.